I was so exhausted. I thought it was long haul COVID. I finally went back to my general practitioner and said, there's something wrong. She said, you know what, go to this cardiologist. He diagnosed me within 3 minutes. I was absolutely floored.
No one ever wants to have heart surgery. Fortunately, these are procedures we do every day here. Daria's a lovely woman who was otherwise healthy, who was diagnosed with a heart murmur. She was subsequently diagnosed with mitral valve prolapse, and that's when she was referred to me.
Did not realize I had been living with this all my life. It turned out to be congenital. How serious it was my first question, and what my long-term prognosis was.
The thing I enjoy most about cardiac surgery, this is one of the few surgical disciplines where you can actually fix the organ. Many other fields of surgery, something's getting removed. We actually have the opportunity to fix the heart's function, and it's really gratifying to see how much more efficient the heart becomes post-op and how much better the patient feels afterwards.
From the moment I walked in, Dr. Terrien was incredibly kind, very thorough, very calm, explained everything with the charts, very visual, so that I could understand it.
Mitral insufficiency describes a leaky mitral valve. Basically, every time the heart squeezes, it's pumping blood backwards as well as forwards. And I always describe the mitral valve as two parachutes that come together whenever the heart squeezes. And just as there are strings that support parachutes, there are strings that support part of that mitral valve called the posterior leaflet. And in her case, those strings had ruptured, such that every time the heart squeezed, you had prolapse of the posterior leaflet. So the correction with that is restoring the proper height of that posterior leaflet. That I achieved using some of her own native cords from the back of the leaflet and swinging them up to the front, called a chordal transposition. I was very happy with the repair, so she should have a very nice, durable result for hopefully the rest of her life.
He doesn't think that, mine was probably a huge procedure, but to me it was. And I know Dr. Terrien doesn't want to hear that, but he saved my life.
I think many patients feel like they have to go to massive academic centers for mitral valve repairs and other cardiac surgical services. We offer all those services here, and unlike some of the other larger institutions, the surgery is performed entirely by the surgeon of record, who establishes that connection with the patient, takes care of them every step of the way, and throws every single stitch. At other hospitals, it might be a resident or fellow seeing the patient, and here we have a much closer connection with our patients.
There's always someone asking you how you are, what can I do for you? That's completely different than my experience with other hospitals.
We were the first on the seacoast to offer cardiac surgery, and 25 years later remain the only program in the area.
I feel great. As of a few months out, I'm back to normal. I'm walking, I'm doing my regular routine now. The change in me in a couple months is just startling. I never thought I would be this way again.